Interesting conversation about staff working from home. Same roles are obvious, such as IT. Some roles are obvious, such as IT. But how have the panelists allowed schedulers, nurses, MAs, and billers to work from home? What infrastructure did you need to add? Was it a new phone system? Are staff members working partly in the office, partly at home, or are certain members 100% from home while others are 100% in the office? I'm trying to figure out the fairness model and how are you ensuring productivity in these roles? So a lot of questions in one, but a great.
Yeah, that could be a whole webinar in itself. So Ertha, would you like to kind of maybe start with this?
Yeah, I'll probably take a stab at it. Don't know if I'll be able to answer all the questions. One of the things, of course, is that we first have to determine who can work from home. Not everyone, as we know, MAs couldn't, physicians, for the most part, who were still working within the clinics, couldn't. But we did leverage our telehealth department and they continued to work from home. We had MAs, of course, who would work with them, who could do this virtually as well. We also had our call center and many of our ancillary services, people who worked with our mammo van that we have, those who are working from our pharmacy and so forth. There's some of them who could have done some of that work from home and didn't necessarily have to be in the office. So it's sitting with your team and trying to figure out exactly who are these people that you'll be able to work from home. Now, with respect to the accountability aspect of it, it's tough to say how you can account for everything that someone is doing. I think one of the things, even as we think about working from home, is that you have to understand that there's a satisfaction that you get if you are working from home and the ability for you to still take care of some of your personal things during that period of time. The question is, are you really interfering with the ability for the business to work? And I think even as we rethink this process, we have to look at it that way as well, because we're still human beings. I'm not going to sit in front of a computer for 8 hours and I'm at home because that's what my employer wants me to do. But I might sit in front of it for the 2 or 3 hours that I need to do good work, and at the same time I can still use some of that time. Now, an employer may say this is not really the best thing that they want, and how do they keep people accountable? Well, you keep them accountable by making sure that they produce the things that you're asking them to produce in a timely fashion. And I feel that that's one of the ways in which you can do that. But trying to see if you can look to ensure whether or not they're actually doing work for the 8 hours that you're looking for, that might be a little bit more difficult to follow.
Yeah, Ertha, I think a couple of things I'll just add to this, and we'll have Manuel chime in here. Is number one, I think that the way we used to lead and manage people was we measured productivity and how much we're getting out of an employee by watching them sit in their seat. So we could walk over to the desk, we see, are they in their seats? They're in their seat. We assume they're working, and we assume they're being productive. What's happening is this is going to force us to really look at kind of understanding what are requirements of the job? What is the production we need? And so instead of looking at and managing by are you in your seat, we look at the quality and the amount of work that you do in the time frame that you're given. What I've experienced is that, especially in early COVID, with a lot of the accounts either consulted with or I've been working with, is that we saw an increase in productivity. More work got done, whether it was a call center, they did more calls, or more work was getting done. And what we found, it wasn't being done in the standard 8 to 5 window that they typically worked in. People would get up early because they don't have a 2-hour commute. They're now working an hour earlier, right? They have no distractions. Yeah, they take an hour off to run to a doctor's appointment or take a kid to school, which is a quality of life. They come back, they're recharged, and they do more work. So we found a level of productivity increase during that process. And the last thing I would say is that, a lot of organizations I've worked with, they basically create categories. There is a person that has to be 100% in the office. There's just certain roles that's the only place it can exist. Then there's 100% of people there's some percentage of that 100% of their work can be done remotely. They don't have to be in an office. What we're finding, the bulk of the work staff is in this hybrid mode where they're a little bit of both. They can do some work at home, they can do some work, and they have to do some work in the office. And they're defining rules around this hybrid kind of engagement. And Manny, just kind of go to one of the things that you and I talked about, is that one of the things that gets lost in this translation is the informal mentoring when it's all at home, right? So there's value in still being together and moving forward. So what would you add?
Yeah, I think if anything, I think really COVID just served really as a catalyst to surface a lot of organizational questions that we had historically that maybe went unanswered, right? So the question of how we measure departments' productivity, are they delivering on what they need to be delivering on for an organization, right? So very quickly for other departments, it became a value conversation. What's the value of them being here versus being remote? And determining, again, building that structure. These have to be 100%. We did a lot of piloting, of course, as many other organizations did. I think we even tried doing virtual check-in from whether it be through text messaging or through telehealth, serving as the mechanism for communicating with the receptionist, right? Those were all opportunities and pilots, but I think they've all driven kind of the thought process that is, how are we going to approach this differently? Should we, essentially encounter ourselves in this predicament again, even more so in the future? So that's just been some of the approach.
Yeah. One thing I'll add, go back to the technology part of the question. I think that there are, I think Zoom and Teams and WebEx, those kind of technologies have really transformed this space. And you cannot be an organization that does remote work and not have a significant investment, not only just in the tools, but to training how to properly use these tools in the most effective way. And those collaboration tools are really powerful in making this happen. And they do allow you to have this kind of conversation where we can see each other, we can talk. So you get the collaborative nature of this. You can also, use these tools for accountability to some level. Another investment I think that really needs to be done is the way we use our telephony systems, our communication systems. We're no longer a phone system. It's really what I refer to as omni-channel communications. It's text messaging. It's video. It's the audio call that we have. Most of what I've seen in the healthcare industry today is still based on legacy type of telephony systems. They're not modern. They're not based on unified communication practices or voice over IP. There needs to be a way of looking at that. If I'm on cloud-based solutions using voice over IP, and this is a little technical, this conversation, what I can do and how I can actually meet my patients where they're at, meet my employees where they need to be, just changes the game. The people that had that were able to move faster than everyone else. And I think this is an essential part of what we do. And the third thing I'll say, once again, these are generalities, and we'll talk a little bit more on the cloud one, is this, being reticent to move to the cloud because of security and compliance. We have to get beyond that. Organizations that are in the cloud have a much superior ability to support a virtualized workforce and change the nature of how they do business. So from the technology side, those are the things I would like at collaboration tools, unified communications, especially omni-channel communication platforms, and then the cloud-based solutions.